Good day, everyone. Today, we are going to talk about
Hfmd or hand, foot, and mouth disease.
But before we formally start to our lecture proper, let's have an icebreaker.
What is Hfmd or hand, foot, and mouth disease? Caused by a group of viruses called enteroviruses. More specifically, are commonly caused by a Coxsackie A16 virus. Although other strains of enteroviruses can also occur hand, foot, and mouth disease like this. Hand, foot, and mouth disease is a highly contagious viral infection commonly in young children, mainly in children under 10 years old, but can also occur in adults.
To understand more further, let's watch this video.
Discovery of enteroviruses. In the 1950s and 1960s, enteroviruses were identified as the causative agents of many viral infections, including Hfmd. Specifically, the Coxsackie virus A16 was isolated from patients with Hfmd and later recognized as one of the primary culprits of the disease. Emergence of other enteroviruses. In addition to Coxsackie virus A16, other enteroviruses, particularly enterovirus 71, EV71, were also identified as significant causes of Hfmd outbreaks, especially in Asia. Increase in Hfmd cases. From the late 20th century to the early 21st century, there was a noticeable increase in the number of Hfmd cases reported globally. The disease became a growing public health concern, particularly in Asia. Ongoing impact. Hfmd remains a prevalent infectious disease worldwide, affecting millions of people each year, primarily young children. Although most cases are mild and self-limiting, severe outbreaks can lead to hospitalizations and, in rare cases, fatalities. About causal agent of Hfmd. The causal agents of hand, foot, and mouth disease, Hfmd, are primarily enteroviruses, belonging to the Picornaviridae family. The two main types of enteroviruses associated with Hfmd are Coxsackie virus A16, CVA16, and enterovirus 71, EV71. Enteroviruses are small, non-enveloped, single-stranded RNA viruses. Here is a brief overview of their structure. Capsid. The outer shell of the virus is called the capsid, which is composed of protein subunits. The capsid protects the viral genome and plays a crucial role in the virus's ability to attach to and enter host cells. Genome. Enteroviruses, including those causing Hfmd, have a single-stranded, positive-sense RNA genome. This RNA serves as the genetic material of the virus and carries all the necessary information for replication and viral protein synthesis. Proteins. Proteins include structural proteins, responsible for forming the capsid, and non-structural proteins, which are involved in viral replication and evasion of host immune responses. RNA polymerase. Enteroviruses carry an RNA-dependent RNA polymerase, an enzyme essential for replicating the viral RNA and producing more copies of the virus.
So how can I get infected? Number 1 is oral ingestions, direct contact with the infected person's nasal secretion and saliva, direct contact with the fluids of an infected person's blisters, their stools, from any respiratory droplets in the air, after they sneeze or cough. So how do I know if my child has a hand, foot, and mouth disease? Early symptoms of hand, foot, and mouth disease resembled as common colds like fever, sore throat, and runny nose. After a day or two, you may see mouth sores, rashes on the skin, or blisters. If the child is not eating or drinking, or only prefer to drink cold fluids, it might be a sign that they are finding it painful to swallow. In rare cases, some complications may arise such as shortness of breath, severe headache, vomiting, dehydration, and encephalitis. Hand, foot, and mouth disease is contagious during the first week of the illness. So how can I treat or manage hand, foot, and mouth disease in my child? Number 1 is medication, hydration, eating soft food, and rest. Now, how can I prevent hand, foot, and mouth disease? Number 1 is frequently hand washing. And disinfecting toys and surfaces around the house. Always remember, that no vaccine against hand, foot, and mouth disease virus. Practice good hygiene as a way to protect yourself and your children from getting infected.
Let's protect ourselves against hand, foot, and mouth disease by performing hand washing. Let's watch this.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.